My name is Richard, I am 69 years of old and I am married for 44 years this June. In 1997 I had a problem with the waterworks. I kept going to the toilet. In the middle of the night, any time when I was at work, all the time. I got so fed up with it, I actually went to the surgery under an emergency appointment, and I saw a woman doctor who was a bit concerned because of the waterworks going all the time, and she thought I had a water infection, so she put me on antibiotics and didn't make any difference, unfortunately. I just kept going. And then they decided to send me to an appointment to a hospital in Enfield, where I saw a consultant and I gave him all the symptoms, and he said, right, we're going to put a camera through the penis to see if there's an underlying problem. Fortnight after I got an appointment, they put the camera down and they noticed that the bladder neck was very tight, it was small, and they couldn't do anything then, so they decided what they would do is to have me in and for the operation itself. I went in a fortnight after, had it done, and when they, under the operation, when the camera was down and everything else, they found a polyp, and I didn't know anything about that, but they did the bladder neck incision and they also took away the polyp. I came out of that and I was passing blood because of the incision, and I was told that I couldn't have intercourse for over a month just to let it settle down, and I had to go back in 6 weeks after. But after a month we tried intercourse and it wasn't right. There was something not right. I couldn't get a proper erection at all. And I thought, oh, that's a bit strange. Oh well, I'll see when I go back. Now I went back, saw the consultant, and he didn't seem all that interested. He said, I'll refer you to another consultant who does the erectional dysfunction. And I went there. I told him that I couldn't get an erection, and then he suggested that use Cavijet, which is an injection into the penis, into the muscle. And he says, I'll show you how to use it. It was painful because he showed me, and I did get a bit of an erection, but not good. Not a good one like it was before. And I thought, oh, you know, it'll get better with time. I used it for quite some time, and then all of a sudden I injected and something went wrong. The hospital didn't even know went wrong because I had to go to hospital. I had a very large lump appear on the penis. I went there and honestly they just didn't know what to do. Nothing at all. They tried getting the urologist to me, and of course he was busy during there, and I went into another room which I got lost. They tried to find me In the end, when they found me, the lump had started to go down, but it was quite significant. They re-injected me with an antidote because although I didn't have an erection, the penis was bent with the lump, hence I stopped using it. So I went back and then they suggested Viagra. When the consultant found me, my penis was actually bent with the lump on the side because it was quite huge. They gave me the antidote and he said it would take about an hour, hour and a half, maximum of 2 hours to disperse. And it was a bit painful, there's no question to it. And they then referred me back to the consultant. 2 weeks I went back, I explained, and I was given the attitude that he really didn't care. I went into a room to be examined. He examined it and he said, yes, there's no lasting effect. And he walked out and saw another patient and left me thinking, hang on a minute, this isn't right. And I heard every single word of what he was saying to the other patient.